Good afternoon, Miller Brown. Let's begin the warm-up session. How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Importance of communication in nursing.
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care and builds trust and rapport. Communication also helps nurses to ensure patient safety by verifying information, reporting changes, and following protocols.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
You can now start your OET roleplay.
Mihiraa, I know this must be difficult for you, seeing Ryan like this. You've done the right thing bringing him in, and I want to reassure you that we've already completed the triage process. During triage, we took a quick but thorough look at his injuries, and I can confirm that while he has some swelling around his knee and a minor external wound, there doesn't seem to be anything immediately severe on the surface. However, we do need to be careful, so the next step is to check for any internal injuries that we can't see right now, like possible fractures. Now, let me explain the next steps of the treatment process. Mihiraa, we will provide preliminary care to Ryan now, and then he will be able to return to the waiting area. And once the doctor is ready, they'll perform a more detailed examination. The doctor will decide if additional tests, like an X-ray, are needed to make sure there are no hidden injuries. Do you have any questions or concerns, Mihiraa?
I'm really worried. He's only 9 and he's injured. He needs immediate attention, but now he has to wait for the treatment. How long will it take? Why can't you do that instead of waiting for the doctor to come?
Mihiraa, I can see how worried you are, and I completely understand. It's really hard when your child is in pain, and the waiting can make it even more difficult. I want to reassure you that we're doing everything we can to make sure Ryan gets the right care as quickly as possible. I wish I could give you an exact time, but in the emergency department, the timing depends on a few things, like the availability of doctors and the priority of other cases that might be more urgent. Mihiraa, let me give you an overview of the triage process. Triage is a quick but thorough assessment of Ryan's injuries. This is how we determine the severity of his condition and prioritize treatment based on who needs it most urgently, like the life-threatening cases. Thereafter, based on priority, treatments will be carried out. I hope it is clear to you.
But how long will all of this take? I don't want him to suffer. He has swelling, and who will care for him in the waiting area?
Mihiraa, I completely understand your concern. No parent wants to see their child in pain, and it's only natural to want him to get immediate attention. I want to reassure you that Ryan won't be left to suffer while he's waiting. We are ready to start with primary care to help with his swelling, and we'll continue to monitor him closely until the doctor is available. You won't be alone in this. Right now, we will apply ice to the swollen area, which will help reduce the swelling and provide some relief. If you can, try to keep his leg elevated while he's resting, as that will also help with the swelling. The most important thing is to make sure he stays calm and avoids putting any weight on the injury. I know it's difficult, but keeping him still will really help prevent any further strain on his knee. We're keeping a close eye on him, and if at any point his condition changes, we'll make sure he's attended to immediately.
I don't think you do this correctly. Give him the preliminary care, I'm taking him, and do not wish to wait to see the doctor.
Mihiraa, I can see how worried you are, and I completely understand why you'd want to take Ryan and seek care immediately. It's incredibly hard to watch your child in pain, and you just want what's best for him. However, I really want to emphasize how important it is that Ryan is seen by the doctor before any decisions are made. While we've provided some initial care, such as managing the swelling and keeping him comfortable, the doctor's assessment is critical to ensure that nothing more serious is going on inside. For instance, Ryan might need an X-ray to rule out any fractures or internal injuries that we can't see from the outside. Sometimes, even if the injury looks minor, there can be underlying issues that need attention, and if those aren't diagnosed properly, they could lead to long-term complications. I know it's frustrating to wait, but the doctor will give you the clarity you need about Ryan's condition. Mihiraa, their expertise will help ensure he receives the proper treatment and that nothing important is overlooked. It's really the best way to make sure Ryan heals fully and avoids any future issues. I promise we're doing everything we can for him, and you're making the right choice by allowing the doctor to assess him thoroughly.
Okay, I understand the situation. Do the best for him.
I promise, we're doing everything we can to keep him comfortable. Would you be okay with waiting for the doctor?
Yes, of course.
Great. That's the best approach. We'll take it step by step and keep you informed throughout. If you have any other questions or concerns, please don't hesitate to ask.